In this chart, we can see very clearly that nerves starting from the cervical region are not limited with the cervical, but they are also going in the head region as well in the arm region. So there are lots of nerves who go here and there. They start from the cervical and supply head region, arm region, and lots of other parts. So here we can see very clearly that cervical 2 is going to the ear. So in this way, this is the nerve innervation pathway. Here also, we can see this is the normal chart. And we can see there are lots of nerve who is wandering here and there, who is going here and there. And they are making the network all around in the body. So this is the cervical innervation. From the cervical vertebra, nerve are coming out, supplying the head region, as well as the neck region, as well as we can see throat region. So from the back side, nerve is coming in the front side as well. And they are also going in the arms. So we can see in this image, there are lots of nerve who is coming from the neck region and coming in the arms. So in this way, never think that if you got any problem in the cervical one, then you will suffer with the only pain in the neck region. It may also create dizziness. So we have to always think in this way. So when we are doing the imagination of turtle in the cervical region, when we are doing the imagination of turtle on the abdomen region, and we treat this area, we treat the neck area of turtle, because this is the neck area of turtle. But we are treating the neck area of turtle. So neck area of turtle start from the RAN 11 to the RAN 10. So this area treats our whole cervical pathology. So this is a very good imagination and it is working very nicely. So in this image also we can see this is the RAN 11 or cervical 1 and this is the RAN 10 or cervical 7. All these conditions we just discussed, we can treat only for here. Now let's proceed further. When we see the other part of the spine, so we can see nerves are going from the cervical spine as well as nerves are coming out from the thoracic spine. The spine is a very important part of our body. So when we see the spine, in the spine we have total 26 bones. So we can see his spine here. In the spine we are having total 26 bones. In the cervical spine we have 7 bones. In the thoracic spine we have 12 bones. In the lumbar spine we have total 5 bones. Sacrum, all bone fused and get 1 bone. The sacrum and coccyx we have 1 bone or tailbone. So altogether there are 26 bones in the spine. So now we are talking about the thoracic bone, the thoracic vertebra. Because thoracic vertebra having total T12, T12, 12 thoracic vertebra. So this is a very important part because we can see here, thoracic vertebra is giving in nerve to the front part also. So from the thoracic vertebra, nerve going to the heart, nerve going to the lungs, nerve going to the spleen, stomach, liver on this part. So that's why thoracic vertebra become a very important part of our body. And it is the longer part than other. Cervical, thoracic, lumbar and sacrum. If we compare all vertebrae, so the longest part is thoracic. The longest part is thoracic. In the cervical, we have only 7, but in the thoracic, we have 12 thoracic vertebra. That is not a small number. So we can see here, this is a very longer part of the spine. So look at here. So when we see the navel region, this is the navel region, or CV8. From the navel region, we are going one tune up. That is CV9. Again, we are going one tune up. That is CV10. Then again one tune up. That is CV11. Again one tune up. That is CV12. CV12 is the starting of turtle. So our turtle is having head here. This is the head of turtle between CV11 to CV12. And this is the neck of turtle between CV11 to CV10. Now, the next term of the thoracic spine. Now we are discussing thoracic spine. So thoracic spine having total 12 thoracic vertebra. So now coming back to the navel region, this is the navel region. From the navel region, if you go one tune down, that is CV7. So thoracic vertebra length here are 3 chun. The whole 3 chun area has been occupied from T1 to T12. So thoracic vertebra start from the CV10. Then it keep on going, and reaching to the CV7. So this is the thoracic 12. So ending of the thoracic vertebra is CV12, CV7. So CV10 is the thoracic 1 and CV7 is the thoracic 12. Okay, what about in between? Let's see. So in between we have CV9, that is thoracic 7. Then we have umbilicus region, that is thoracic 10. These are the junctions. So 1, 7, 10 and 12 means we can look at here again. This is the navel region or CV8. From the CV8, if we go one tune up, then again one tune up. Then there's a CV9 and the CV10. So this is the thoracic 1. This is the thoracic 7. And this is the thoracic 10. So let's see first this part, thoracic 1 to thoracic 7. If we see the spine, many times people are complaining us that they are having pain here in this area. So this is the bone. The name of this bone is scapula. This is the bone. The name of this bone is scapula. If we take our both hand in the back side, then we can feel this bone. The name of this bone is scapula. And if we see the lower border of the scapula, that is the location of thoracic 7. If we see where neck is ending, that is the location of thoracic 1. So if anyone is suffering with pain in this part, so this is the area between the thoracic 1 to thoracic 7, and thoracic 1 means RAN 10, and thoracic 7 means RAN 9. So upper back pain can be treated from this area. So upper back pain can be treated here. So if anyone complaining us, I have back pain, we will ask, tell me the location. And he is telling that I have back pain here in this part. This is painful area, or this is painful area, or this is painful area. And if someone is having pain in the thoracic spine, pain in upper back, in this area. So this is the starting, or we can tell it RAN, and this is the ending, RAN 9. So between RAN 10 to RAN 9, we can treat. So here, this is the upper back area. This one. So from, we can see now very easy. CV 12 to 1, this is the head area. We can treat migraine, headache and all. CV 11 to 10, this is the neck area. We can treat neck pain, cervical spondylosis and all. And now CV 10 to CV 9 is the upper back area. So we can treat the condition of upper back, condition of lungs, condition of heart, condition of any part, either on the back side or on the front side or at the level of this area. So this area is very useful for these conditions. So we are regularly using these points. They are very wonderful and bringing the effect very immediately. And patients are very happy because needle here is painless. So patients are very happy when we do the treatment here. Even we can do the massage and we can bring the effect. So if we see the spine, so thoracic spine start from here and ends here. So this is the upper area of thoracic spine. This is the middle area of thoracic spine. This is the lower area of thoracic spine. So from the navel, if you go down one chun, that is the lower area. If from the navel, if you go one chun up, that is the middle area. So in this way, if someone suffering with a thoracic pain, because lumbar is here, we are not talking about the lower back pain. We are just talking about this area. If we divide this area in three parts, upper, middle, and lower. So this is the upper part. This is the middle part. And this is the lower part. So any problem in the upper part, either front and back, any problem in the middle part, either front and back, any problem in the lower part, either front and back. So any problem between T1 to T7, T7 to T10, T10 to T12 can be treated in this with the help of these points. So if someone is suffering with a pain in the upper back, treat this area, middle back, treat this area till the level of navel region because this is the navel. And lower thoracic spine, treat this area. So with the help of this area, between CV10 to CV7, we can treat all middle part of the body. So now look at here. This is the head region. This is the neck region. And this is the thoracic region. So head region between 12 to 11. Neck region between 11 to 10. And thoracic region between 10 to 7. Maybe look at this other image. So if pain in this upper part, we will treat upper area. Pain in this middle part, we will treat middle area. Pain in this lower part, we will treat lower area. So this is the navel region or CV8. We are going one tune up. Then again one tune up. Then coming back to the navel. From the navel, we are going one tune down. So this is the upper thoracic. This is the middle thoracic. This is the lower thoracic. Or these are T1 to T7. So T7 to T10. And these are T10 to T12. In this way, we can rectify all the problem. When we talk about the T1 to T7, in the back side, we have thoracic spine. In the front side, we have lungs and heart. So while treating these area means CV, so this is a central line. This is CV8, CV9, CV10. CV10 is the starting of thoracic vertebra, T1. CV9 is thoracic 7. So if we treat this area, we can even treat lungs and heart. And upper back pain. In the same way, from epinodal between CV9 to CV8, we can treat middle. And if we treat between CV8 to CV7, we can treat lower thoracic areas. So this is a very good activation and stimulation of the thoracic spine. So now, the most important is lumbar or lower back area. Or lumbar spondylosis. Nowadays, people are suffering a lot with the problem of lumbar spondylosis. So see, this is the head region. This is the neck region. This is the thoracic spine. So this is the cervical, this is thoracic, this is the head region. Then this is the lumbar region. Now here, RAN 6 to RAN 4 area are treating all the condition of lumbar spine. So this is the very most important point between RAN 6 to RAN 4 area. How to measure RAN 6 and RAN 4 area? From the navel region, if you go 1.5 tune down or 2 finger down, that is RAN 6. Again 1.5 tune down, that is RAN 4. We already done the discussion from the navel to the RAN 4, is it 3 tune? So in this way, this is the navel region. You needle 2 finger down and again 2 finger down. So on the location of RAM 6 and RAM 4. With the help of this, you can treat lumbar 1. So RAM 6 is the lumbar 1. And here you can treat lumbar 5. So RAM 4 is the lumbar 5. In between, we have all the other vertebrae. So as per this image, if you see this image, navel is CV8. From the CV8, if you coming to finger down or 1.5 tune down, that is CV6, or starting of lumbar spine, L1. Then you go down, 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 coming to CV4. That is the ending of lumbar spine. So from the CV6 to CV4, you can treat all the spine conditions, especially lumbar spondylitis and slip disc and pain of the lower back areas. So be up to needle CV6 and CV4, as well as beak and needle middle areas, because CV6 is the lumbar 1 and CV4 is the lumbar 5. And in between we have other lumbar 2, 3, 4 and others. So as per in this image, we can see here, from the navel region, if you are going 2 finger down or 1.5 tune down, that is the location of CV6. That is the location of lumbar 1. And again, you are going 2 finger down or 1.5 tune down. That is the location of CV4 or lumbar 5 area. If you needle this all area or in between, so we have lumbar 2, 3, 4. So in between this area belong to the lumbar 2, 3 and 4. So we can cover all the area, or as per the requirement. Suppose someone is suffering with the lumbar 4, we can treat this part. So we can needle 3 needles, one on the CV6, one on the CV4, and 1 or 2 needle in between. So this area is very highly effective for lower back pain. Actually, abdominal acupuncture has been discovered by Dr. Bo. As per the Dr. Bo, when Dr. Bo was telling about the abdominal acupuncture, he told that one patient came with a complaint of sciatica. He tried everything, traditional acupuncture and other thing, but he didn't get succeed. As soon as he treated this area between CV6 to CV4 area, suddenly patient told, my pain gone. After 5 minutes, the patient told, I don't have any pain. And the most important things, pain didn't reappear again. So it was a very great incidence of the Dr. Bo life. So with this impression and influence, he discovered abdominal acupuncture. So whenever you want to treat the lower back area, remember CV6 to CV4. So this is the L1 and this is the L5, lumbar 1 to lumbar 5. And CV4 is the ending of lumbar spine. So as soon as lumbar spine ends, then this is the starting of the last part of the spine, that is sacrum. We know what is the last part. Look at this image. When spine is ending, so this is the lowermost part, which is called sacrum or sacral spine. This is the lowermost part of the spine. So now we can't see the sacrum. It disappeared. So what disappeared? That is the sacrum. That was the sacrum. And this lowermost part is the tailbone or coccyx. So in this image, we can see this is the sacrum. If we just see down, this is the sacrum. All the 5 bones got fused and become one bone. So this is called sacrum. And below the sacrum, this is the coccyx bone. So now we will see after completing the lumbar vertebra. Now this is the turn to see the sacrum spine. So as soon as our CV4 completed, so this is the navel region, or CV8, one tune down, CV7, one tune down, CV5, one tune down, CV4, one tune down, CV3, and one tune down, CV2. Between CV5 to CV6, we have CV6. CV5 to CV7, we have CV6. CV6 to CV4, this is the lumbar spine, L1 to L5. And between CV4 to CV3, we have sacral spine. And CV3 is the tailbone. Tailbone. So if someone is complaining you, can you treat my pain of the tailbone? So we can needle CV3. Can you complain my lower back pain? We can treat lumbar area. So lower back pain means lumbar area. If anyone complaining you sciatica, then we can treat lumbar area as well as sacrum area. So lumbar area is CV6 to CV4. Sacrum area CV4 to CV3. And tailbone or coccyx is CV3. So let's summarize all the things. So this is the center line. This is the REN 8 or CV8 or umbilical. 9, 10, 11, 12. In the down, 7, 5, 4, 3. This is the navel region. Now, REN 12 is the head region. REN 11 is the cervical one. REN 10 is the cervical 7 and thoracic 1. REN 9 is the thoracic, REN 10 is the cervical 7 and thoracic 1. Then REN 9 is the thoracic 7. Umbilical or REN 8 is the thoracic 10. REN 7 is the thoracic 12. So thoracic vertebra end on the REN 7. So at the location of REN 6, our lumbar 1 starts, and at the location of REN 4, lumbar ends. So REN 6 is the L1, REN 4 is the lumbar 5, and REN 3 is the coccyx or tailbone. So this is the summary of central line. This is the very quick and brief introduction of turtle acupuncture. Because when we make the turtle acupuncture, this is a central line, this is the stomach meridian, Tuchun. This is the spleen meridian. Fortune. So this is the RAN 8, RAN 9, RAN 7. B draw a horizontal line from RAN 9. This is the stomach point. Then we tell this is just where I am forming the turtle. I'm not explaining this how I'm making the turtle because this explanation needs more time. This is the arm of turtle. This is the legs of turtle. This is the head of turtle. This is the neck, the thoracic spine. So whenever we learn the turtle completely, then we can treat shoulder joint, we can treat elbow joint, we can treat wrist joint, we can treat the finger pain, we can treat hip joint, knee joint, ankle joint, tailbone. But today our topic only of the spine explanation. And whole explanation of the turtle need minimum 10 to 12 hours. So we don't have that much time because just recently we have completed the turtle acupuncture class and that was near about 10 hours class. So this was just over 90-minute class. So I tried to explain you how to treat the spine, but detailed explanation need minimum 10 hours. In the detailed explanation, we can treat multiple things, including all the joints, all the hormone problems. We can make many other protocols. So just today was our session only for the spine. So we have discussed how to treat the cervical spine, thoracic spine, lumbar spine, sacral spine, and coccyx, as well as the brain areas. So enough for today, and thank you so much.